Hi, my name is Tara. I'm a nurse practitioner student at YSU. Today I will be interviewing Kelly Shank, nurse practitioner. So Kelly, can you tell me about yourself?
I've been a nurse since 2003. I originally went to nursing school at CCBC, Community College of Beaver County. I got my associate degree and I worked as a nurse at Sewickley Hospital on the med-surg unit from 2003 until 2017 when I finished my NP degree. I actually went back in 2013 for my bachelor's. I did that at Waynesburg University, which has a Cranberry campus, which is close to my house. And then I decided to do my nurse practitioner degree at Carlow University, which also has a Cranberry campus. So most of it was done. I didn't have to actually go into Pittsburgh, so it was kind of nice. I have 2 kids. They are grown. My son is in the Army in Texas. He shoots Patriot missiles, and my other son just graduated from high school. And I am married to my husband, which kind of crazy. We got married in 2013, right when I went back to nursing school. So I told him, I said, this is going to be hard and you have to stick with me through it. And he did. So I figure we could probably make it through anything.
Most definitely.
Yeah. So as far as myself, I just I don't know. I mean, I like my job that I have now. I just got a new job in April, so I really, really like that, which I know that's your second question.
Oh, yes. I can ask that right now if you want me to.
Yeah, go ahead.
Okay.
Yeah.
Can you describe your APRN position and including your specialty, please?
Yes. Currently, I am working as a wound care nurse practitioner. I work for U.S. Wound and Vascular. We round in nursing homes. And so it's kind of, I round in the mornings and I come home and do all of my documentation. So so I've only been there since April, but it's kind of a thing where I'm working with a bunch of people that I used to work with. I used to work at my very first nurse practitioner job was with Gola Plastic Surgery. And that job entailed mostly wound care. So I rounded at nursing homes with that job. I also went to LTACs and I rounded at Butler Hospital and I worked at the Butler Wound Clinic. Plus, we did some plastic surgery. So that job was a little crazy. It was a ton of driving, sometimes like 7 stops in a day.
Oh my goodness.
Yeah. So, I was just like running from one place to another. But the good thing about that job, I met most of the people who I currently work with. It's kind of, a lot of them used to work for Dr. Gola, including 2 of the people who run the practice now.
Well, that's nice, yeah.
Yeah, so it's really nice. They reached out to me several times and were like, hey, do you want to come work for us? But in between there, I did do asthma, allergy, and immunology, which I really liked, but I was driving a lot still because he had 9 different offices.
Oh my goodness.
Yeah, and the furthest I drove was I live in Mars, which is near Cranberry. And I was driving from Mars to Washington, PA, and I had to be there at 7 a.m., which in the winter, that was a little far. And I wasn't getting home from that job until like 6 p.m. at night, a lot of nights. So this new job, like I said, I'm home I think literally every day before noon.
That's awesome. That is really awesome.
Yeah, and then I today I threw in some laundry. I cooked. I started my dinner. I, cleaned up my kitchen. I did a whole bunch of stuff. I'm actually sewing my husband's sweatpants now. Plus, I rounded on 18 patients, did debridements, and did all my charting. And so.
And you're done. Wow.
Yeah. Yeah, I'm done.
Wow.
Yeah. And I kind of, like I said, I could have been done a lot earlier. I was home at like 11:30 today.
Wow.
Yeah, so it's kind of, it's nice.
Yeah, that is very nice. That's like a dream job, I feel like. You're not gone all day.
Obviously, wound care is not for everyone. I do bone biopsies. I do debridements. We're trained to remove the dead tissue and do wound cultures and things like that. But I actually removed a bullet from a 20-year-old boy who was in a drive-by.
Oh my gosh. Wow.
Yeah, last week. Apparently it had been in there for over 2 years.
Wow.
And the doctor, and it was the first time we had just started at that facility, and they were like, we're planning on sending him out to plastic surgery. But, can you take a look? And when I looked at it, I was like, this is like going to come out easy. And I just gave it a little squeeze and it popped loose and, I got it right out. So I think probably his body did most of it, but they were pretty pleased, that I got it out.
That's nice.
Because I think some people weren't even willing to try, So, yeah, that's the craziest thing that I've done. But
to have like the guts for that, I feel like, and smell all of that stuff.
yeah. Mostly it doesn't. There's pretty much nothing that bothers.
Well, that's good. You're in the right job.
But yeah, no, I really like my current job, and it's like some jobs, especially in the Pittsburgh area, you're gonna find, and that's one of the barriers, which I know that's another question you have. In the Pittsburgh area, you're going to find that UPMC and AHN kind of pushed the pay down for NPs, When I started as an NP, I interviewed at AHN, and they wanted to pay me basically what I was making as an RN.
Oh, my goodness. Yeah.
Yeah. So you will run into that, but you can find, higher paying jobs. You just have to look.
Yeah, don't take the first one that is offered, especially if it's low. So you would say that's one of the barriers of, that APRNs face?
Yeah,
today?
Definitely in our area. I think in some areas you can definitely make more.
Yeah.
But also one of the other barriers is obviously in Pennsylvania, NPs are not allowed to practice independently yet. And, I think the bill passed, I'm trying to think. I believe it's in the House of Representatives this fall to try to get passed.
Okay, yeah, so soon.
For NPs, but it's been years. It's been years, literally. For NPs in Pennsylvania to be allowed to practice independently. And at last count, I was looking it up. I believe 21 states currently allow nurse practitioners to practice independently without having to have, be under a prescriptive authority through a doctor and things like that. So I do think that would be huge for Pennsylvania if we can get that passed.
I absolutely think so too. And do you see an APRN influence in today's healthcare system? If so, how?
Oh, definitely.
And if not, why?
Yeah, definitely. So, I think that especially in underserved and rural areas, NPs are extremely important. And as the baby boomers continue to age, I think we're going to see more and more doctors are going to be retiring. There's going to be less and less available for people to have as their PCPs. So, even the practice I get to, I think they have, now not all of them are in the office because some of them are out in the hospitals and things like that, but I think they have like 10 or 12 PAs and nurse practitioners. And then I've never even seen the doctor. I think there's 2 or 3 doctors in the entire practice.
Oh, wow.
But I've never seen the doctor. I've always seen one of the nurse practitioners. And I'm fine with that. I feel like the care that I get is excellent. And, and the one time I had a weird lymph node that I had to have ultrasound. And the nurse practitioner was like, I showed it to the doctor. And, so she does, I do think that the nurse practitioners reach out to the physician as needed, which, is important. But, I'm completely comfortable with seeing nurse practitioners. I feel like a lot of times they spend more time with you. They listen to you.
I completely agree.
And I think research has shown that patients have more positive outcomes when they are treated by a nurse practitioner.
I do. I do agree with that. Absolutely. And what changes would you like to see made for APRNs?
Well, obviously, I do think in Pennsylvania, having full practice authority, would be probably the most important thing. There are a lot of physicians who are opposed to it, and the physician groups actually lobbied against it, which I think ultimately it will pass, and I think it'll be better for the patients, So I do think that's probably one of the most important changes.
I do. I agree with that. Well,
and I think the other thing would be that, more patients are aware of who and what nurse practitioners do. But I do think a lot more are familiar with them just from meeting them in their, doctor's offices and things like that. I think it's
okay.
Because it's kind of crazy when I first told my husband that I wanted to go back to nurse practitioner school. He's like, "What's a nurse practitioner?" And I was like, "Oh, really?" And now he knows all about it. So
tells everyone about you. All right. Well, thank you.
You're welcome. If you need anything else, just let me know.